AM 1240 and 95.3 FM, WJON. It's Health Matters, brought to you by Rejuv Medical. My guest today is Dr. Matthew Janzen from Rejuv. Dr. Janzen, thanks for joining me again today.
Yeah, no problem. Glad to be here.
All right, so today we're talking about cold weather and the effects on our health. Boy, where would you like to start? I mean, certainly when you get colder weather, it seems like we get colds and sicknesses more often. Is that because of the weather?
Yeah, that does play a big role. And there's a couple of reasons for that. So, I mean, in general, weather patterns are becoming more variable over time. And so while we enjoyed a record heat this summer, we might have to deal with also a record cold this winter. Both the Old Farmer's Almanac and the New Farmer's Almanac predict that we'll have below average temperatures. And cold weather it's not just uncomfortable, it does have a significant impact on your health. In fact, the death rate is higher in winter than the other parts of the year, and particularly in the elderly population. Some studies have demonstrated that people who experience symptoms related to either their heart or lungs, so like chest pain or shortness of breath, when they are exposed to cold weather, are much more likely to be hospitalized and even have a slight increased risk of death. The cold, also has a big impact on your musculoskeletal pain. So joint aches, muscle aches, all are more increased in the cold. And then if you're working in the cold, you have an increased risk of accidents and injuries. So there's also a lot of, direct effects of the cold and indirect. So in addition to those direct effects with the effect on the body, there's the indirect effects such as like air pollution can increase people's pulmonary diseases. There's a lot of increased accidents, kind of slip and falls on ice and snow that can even be deadly. So if you'd like, we can talk a little bit about what happens to your body in the cold.
Yeah, that's a good one for sure. Because I mean, the more you're talking there with all the different possibilities of bad things happening as to in the winter, I'm like, boy, I can't wait till March
Yeah.
or April, depending on when it gets nicer. So, what
Yeah.
is happening to the body when it does get cold? Then?
So when you're exposed to cold temperature, your body initiates a total systemic response, and that first starts with vasoconstriction. So the blood vessels that are in the skin of the extremities will start to constrict, kind of limiting that blood flow. And that's in an effort to try and limit heat loss and divert blood primarily to the more vital internal organs. But if the body continues to cool down, so if you're exposed to colder temperatures for longer and that's not enough, then the core temperature of your body will also start to decrease, which will stimulate those muscle contractions, shivering. It'll stimulate increased breathing and increased heart rate, all in an effort to kind of generate more heat within the body. And if the body still fails to maintain that core temperature above at least 35 degrees or 95 degrees Fahrenheit, which is how we define the kind of cutoff for hypothermia is below that 95 degrees, then the functions of the heart and the brain can be critically impaired. So prolonged exposure to cold can put the brain at increased risk of a stroke or a transient ischemic attack. And it also puts the heart at a risk of arrhythmias and even a heart attack or cardiac arrest. The body can also have a number of other health effects associated with the cold, including, increased muscle strain, increased fatigue. It increases your blood pressure, increases cholesterol, and also increases blood clotting factors that are circulating in your blood. In addition to just the cold temperature, makes it a little bit more viscous, a little thicker, and more prone to clotting. So, and then a big factor in your health is that the cold, it's in and of itself suppresses the immune system, which can be especially detrimental in the cold season when we're gathering more and in closer proximity, that things like pneumonia and influenza can be more common.
Because we're spending more time inside with other people and we're spending less time where you've got air that's not like fresh air is certainly better than the circulating air that we got on the inside.
Yeah, absolutely. Yeah.
So when you're talking about the extreme, the cold weather, and we certainly have extremes here in Minnesota. If you were in a state that had extreme warm weather, like Florida, maybe Arizona, does that have adverse effects on our bodies as well?
Oh, definitely. Yeah. The high heat is also another thing that can significantly increase people's mortality and risk of kind of dying or having exacerbations of their medical conditions. And again, that's much more common in the elderly that are just, as you're older, your body is less able to kind of thermoregulate a lot of those little systemic changes with the cardiovascular system and your kind of autonomic nervous system that helps regulate those things. It just doesn't work as well and it doesn't respond as quickly. So those things can have a bigger impact.
Why are some people seemingly colder than others or affected by it more than some other people are?
So a lot of that has to do with that autonomic nervous system. So it's kind of this part of your nervous system that's out of your control. It's not something that you can turn on or turn off, but that helps regulate your body's temperature. Is kind of involved with a few different factors that kind of are involved with digestion, hormones, and everybody's a little bit different in that, and it can kind of range. And partially that's probably due to genetics and that some people are just better able to survive in colder climates or warmer climates. So it's just a lot of little factors that can play into that, but it's certainly not just somebody's choice as to whether or not they like the cold. It's not just their conscious decision.
My guest today is Dr. Mathew Janzen, Rejuv Medical. Today we're talking about cold weather and how it affects our health. All right, Dr. Janzen, what are some of the risk factors that we should have and be aware of as we head into a cold weather season here?
Yeah, so not all types of cold weather are equal, and not all individuals are equally vulnerable. So when it comes to individual risk factors, the biggest risk factor is age, due to kind of like I alluded earlier, the body's inability to thermoregulate, and just with age, there's a frequently a increasing number of medical conditions and comorbidities that just make older individuals more vulnerable. But then there's also a lot of underlying health conditions that, such as diabetes, heart disease, and especially respiratory disease, that are all independent risk factors for being more susceptible to the negative impacts of cold weather. And a couple of studies have also suggested that in the population of people over the age of 65, that women are a little bit more vulnerable than their male counterparts. And there isn't a good, clear explanation for why that is. Could be hormones, it could be, weight, and kind of how body mass is distributed differently. But so far, there isn't a clear explanation on why women are maybe a little bit more susceptible. But then, in addition to the individual risk factors, there's environmental risk factors. So, some specific influences that are associated with the negative impact of cold weather include wind or draft. So, exposure to either one of those puts you at a much higher risk of being impacted by the cold weather. And that's just because both of those can have a significantly increase that heat loss from the body when it's either blowing your body's heat away, or just conducting it away quicker if you're in a wet environment. And then there's also kind of more general environmental risk factors. So studies have shown that smaller rural communities are more vulnerable than larger metropolitan areas. And that's maybe in part due to different community resources such as homeless shelters or things like skyways, and then also heat trapping in kind of densely packed metropolitan areas with the more closer buildings and closer proximity to vehicles, all can make an impact on kind of how heat and cold is dispersed and experienced.
Now, I wanted to bring up when
Then,
you,
yeah.
Dr. Jansen, sorry to interrupt, but I wanted to, ask you about muscle mass. Does muscle mass make you less cold in the winter if you have enough of it? Does that play a role at all?
It can to some degree. So, certainly muscle is a good way of kind of quickly generating heat. And it can also be a little bit of an insulation factor as far as kind of keeping that core temperature warmer. But then different people are a little bit different in how their peripheral vascular system is set up. So they might have a little bit more blood vessels on the surface that can actually cause it to be easier for that heat to dissipate. So in general, it probably does help most people, but for some people, it can be a little bit of a challenge for them to thermoregulate a little bit better.
How about when people are getting, they've been outside for a long period of time, hypothermia, or their face starts to look really red? What's happening to the body when those things are going on?
So yeah, with the like that kind of redness that you're getting, it's the body actually typically responding to that cold environment and trying to protect itself. So some of it is that when the blood vessels initially constrict, all that trying keeping that warm blood into the core, once that core starts getting a little bit cold, or there gets to be too much of a difference between the temperature of your extremities and the temperature of the core, then the blood starts to kind of balance out and go back out into the extremities more. So you can get kind of a rebound effect a little bit. Also, the cold can just be kind of irritating. It can kind of stimulate the nerves and almost set off like a almost like a pain response that can also kind of cause that increased blood flow that gives you that red color.
Sure. I wanted to bring up, since you were talking about, dealing with those kind of situations, how about someone's circulation? Do we all have the same type of circulation, or is that going to vary, and how does that affect us in cold weather?
Yeah, so the your circulation can vary greatly, especially in people who have diseases related to their vascular system. So either peripheral arterial disease, venous congestion, heart disease, atherosclerosis, hardening of those arteries. The blood is just it's a little bit less as those arteries get hardened, then it's harder for them to kind of adapt as much. They can't change. They don't have that variability or that range to kind of dilate or constrict as much. So that puts them at a little bit of increased risk. And then also that increase in blood pressure that we see in the cold, that can also be a contributor to some of these things like the heart attacks and strokes that are going on because some people, already have high blood pressure and then that pushes it up further and can cause further issues. So it can vary a lot person to person and can be a big issue for people that have a lot of those comorbidities that the cold can just play a much bigger role.
My guest today is Dr. Mathew Janzen, Rejuv Medical. Today we're talking about cold weather and the effects it has on our health. All right, Dr. Janzen, so when we have like snow, for instance, in southern states, like in Texas, they don't know how to deal with it, one. And it also seems to affect them more. And I know when people in Minnesota might vacation to Florida in, say, January, February, we're going to wear shorts, even if temperatures for the people there wouldn't warrant it. Are we conditioned to handle certain types of weather depending on what we're used to?
Yeah, absolutely. A lot of us do get used to, and your body does kind of adapt to, the environment that it's been spending a lot of time in. So you do kind of get used to those temperatures. And so, yeah, when we go down to Florida, it, even if it's not warm for them, it feels great to us. And we're going to be out walking around in shorts. And it can also have a big impact on people's health. So when those areas that are not used to the cold get a cold snap, you see a lot more of the impact on people's health, and that it all comes down to that adaptation of what you're doing to adapt. So that's a big thing, and we can talk more about what you can do to kind of decrease your risk of harm from the cold.
Yeah, so what can we do?
So oftentimes, prevention is typically the best measure with this. So, on those days when it is very snowy, icy, just try and avoid going out if possible. And similarly, on days where it's very windy or, below zero temperatures, try and avoid going out or at least check the weather and at least try and find a time when the weather is more favorable that you can kind of hit a high temp or maybe lower wind, that you'd just be at less risk of being exposed to the extreme kind of conditions. And then if you are going to go out, prepare yourself first, bundle up with lots of layers, keep extra available, in a car or something to keep some blankets. It's a good idea to keep like an emergency kit in the car. It's also important to keep a phone on you if you're going to go out. So if there is an issue that you can contact someone for help. A big factor is trying to keep as little exposed skin as possible. So using hats, gloves, scarves, kind of heavy socks, those kind of things to keep that skin covered. Just because the cold, like the frostbite, is going to be less likely to occur if it's covered. And also just for the condition of the skin, it'll dry out a lot faster if it's just exposed to the elements. You can also, a good tip is to kind of try and keep your core warm by drinking a hot beverage before you're going to go out. And then you can also continue to try and keep yourself warm by bringing like a thermos of something hot and continuing to drink it while you are out. That can just heat up that core and can kind of be like a heated gas tank for you that can last and help that blood internally stay nice and warm and keep you primed.
Are people,
Um,
Dr. Jansen, are people better about handling cold weather the younger they are than when you get older?
So yeah, I mean, some studies have suggested that it's kind of debatable when you're talking about people around like the 50s, 60s, that it can kind of go either way. But generally, that over the 65 tends to be a little bit more vulnerable and have more issues than, younger populations. But again, it does play a big role on what kind of risk factors and health you have. So if you've got, COPD or bad asthma, you're more likely to be impacted, even if you're younger, than somebody who's older but healthy without those kind of conditions.
So if you're someone who is getting up there in age and maybe you feel like you've been cold for a long period of time, do people, are they better suited just for their health to live part of the year in a warmer climate?
Yeah, I mean, I think that's not a bad idea for certain people. To be able to kind of have that snowbird style where they get to enjoy the beauty of Minnesota as long as they want, and if they want to get away when it's those kind of frigid months of the late January, February kind of time period, that can be have an impact. I mean, but every place kind of has its pros and cons, so you do have to be careful about, air pollution and sun and different environmental exposures that other places in the South have as well.
So we're talking about, you mentioned frostbite earlier. So what is the sign that you're starting to get frostbite?
Yeah, so there's a couple of signs. One of the first signs is kind of that turning the pink, that or pinkish red on the skin. That's kind of a very mild form of frostbite. That's kind of affecting the more superficial layer of the skin, that epidermis. Um, that when you start getting that kind of numbness, tingly, kind of loss of sensation, sometimes kind of stiffness in the muscles, when the hands stop or feet stop kind of working as well, that's kind of a sign that things are not, that the blood flow is not getting to those tissues as well, and that you're kind of approaching that frostbite thing or the kind of that severity. It typically, to really just see what stage of frostbite you got to, it takes a while for those to show up. So if you start noticing, the day after or a couple of days after that you see kind of whitish blisters over the skin in an area, then that's a sign that you got a decent frostbite there. And over time, that if that starts turning black, then that tissue is actually dead. And, you definitely would want to go to a hospital and get checked out for that, because there are significant complications that can occur if that's not treated quickly.
Dr. Matthew Janzen, my guest today from Rejuv Medical. Today we're talking about cold weather and the effects it has on our health. I think it's the first segment you mentioned that falls certainly can happen. People slipping and falling on the ice in the winter months. We know that these are things that go on. If you have a stronger core and better balance, will that make that less likely to happen?
Yeah, absolutely. That balance and just kind of the strength in your extremities and reaction time can play a huge role in your ability to, sustain little slips or little minor kind of loss of balance kind of issues that can very quickly turn into really catastrophic injuries if you're falling, on hard surfaces, especially out in the cold where somebody might not see you right away. It can really be a terrible situation. So if you can avoid that, it's greatly to your benefit.
So, what suggestions do you have to try to improve someone's core strength and balance?
Yeah, so there's a great kind of physical therapy team that we have here that can work on things, if there are deficits. And, even if you don't have medical condition or, strictly like loss of sensation or other issues, you can come in and get checked out and we can kind of see how you are doing with balance and kind of get you set up with a program to kind of get that optimized before winter, so that you're ready to tolerate things. The other thing that can be very helpful is kind of how you're walking. If you are walking on a slippery surface, it's recommended that you kind of actually walk like a penguin. So interestingly enough, you kind of put your body's weight of your upper portion a little bit more forward, kind of keep your knees relatively straighter, and try and make kind of little steps with your arms kind of ready at your sides so that you can kind of use them to keep your balance if you do have to walk over something that's a more slippery surface. Again, the best measure is to just prevent that. So if there is a slippery surface, avoid it, kind of stay in and just keep away from a fall situation.
Does what you eat and how much you eat, along with how much you exercise, does that play a role at all in how we might be able to be equipped to handle cold weather?
Yeah, yeah. So again, it kind of comes back to those health factors. So if you are, it's a great time to optimize your health before, we really get into that cold season, and make sure that your blood pressure, blood sugar, weight, all your medical conditions are being optimized to decrease your risk of harm from the cold. So it is a great time to kind of check in with your primary care provider and make sure that your health is being optimized. And if you don't have a primary care provider currently, you can check out our great team of providers at Rejuv. So we've got good people that can take care of you and get you optimized for winter.
What are some aches and pains examples that you would suggest that could be occurring during the winter months that people would really want to get checked out?
Yeah, so really anything that's going to contribute to pain or stiffness, weakness, or any kind of issues with your back, hips, knees, ankles, or feet, now is a good time to get those issues treated and really kind of get your health in prime shape, because with that cold weather, those issues are likely going to be exacerbated. And, it's sometimes just helpful to kind of stay ahead of that and get things feeling better before it's really, too late and you're miserable and losing sleep because of increased pain when we have those cold days coming.
Anything that we haven't touched on in regards to cold weather that you wanted to bring up, Dr. Jansen?
No, I think we covered a lot of good stuff here. So, but if people have other questions or issues or things that they would like more information on, they can check us out at rejuvmedical.com or give us a call at 320-217-8480.
All right, Matthew, thank you. Appreciate it. Look to talking to you again soon.
Yeah, stay safe and stay warm.
Yeah, you too. That's Dr. Mathew Janzen, Rejuv Medical. This has been Health Matters in WJON, brought to you by Rejuv. We return next week at this time.